Aaron, I have it's 9 o'clock. Are you ready?
Yes, ma'am. I just started the recording.
Okay, Craig.
All righty, thank you. Good morning. Today is Tuesday, January 12th, and this is a regularly scheduled meeting of the Kings County Board of Supervisors. Due to issues arising from COVID-19, the board is using teleconferencing format for today's meeting. Most board members are not in the, some of the board members are not in the board chambers today. We are participating via the World Wide Web. If you would like to make a public comment today, please make sure you are identified by name in the WebEx system. For those interested in commenting today during unscheduled appearances, please use the raise your hand feature and wait to be recognized. Each speaker will be allowed up to 2 minutes for public comment. Each vote today will be a verbal or voice vote so that members of the public can hear how each board member has voted. After we've had a motion and a second regarding each item we are taking up today, we will be doing a roll call vote by district. Madam Clerk, would you please call the roll?
Joe Neves.
Here.
Richard Valley.
Here.
Doug Verboon.
Here.
Craig Peterson.
Here.
Richard Fagundes.
Yes.
Okay, thank you. We have 5 in attendance today. Moving on to the invocation, and today we have Brian Kleinhammer of Kingdom Culture 2.0.
Good morning. Let us pray. Father God, as we see the chaos developing, as we hear more emergency sirens throughout the day, and as we see the beds of the suffering line the hallways of Adventist Medical Center, we know you will get us through this because you always have. Draw us close to you, Father, as we move forward. In the mighty name of Jesus, amen.
Thank you. Would you please join me in the flag salute? Ready, salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, and with liberty and justice for all. All right, we'll move on to unscheduled appearances. Any person may directly address the board at this time on any item on the agenda or any other items of interest to the public that is within the subject matter jurisdiction. 2 minutes are allowed for each item. Madam Clerk, do we have any unscheduled appearances?
I do not see anyone with their hands raised.
And do we have any written?
No.
Okay, very good. Before we move on to the approval of the minutes, just like to remind all the staff that are presenting today, this is a newish medium and things happen. We understand that. So everyone that's on the agenda today, please be ready. If I have problems with one, I'll move on to the next and then come back to you. So at this point in time, I would entertain a motion to approve the minutes from January 5th, 2021.
Minutes from January 5th, 2021. I'll second that.
Okay, we have a motion and second. Madam Clerk, would you please call the roll?
Supervisor Neves.
Yes.
Supervisor Valley.
Aye.
Supervisor Verboon.
Yes.
Supervisor Peterson.
Aye.
Supervisor Fagundes.
Yes.
Okay, 5 in favor. Thank you. On to the consent calendar.
I'll make a motion to approve the consent calendar as presented. Verboon. Second.
All right, we have a motion and a second. Madam Clerk, please call the roll.
Supervisor Neves.
Yes.
Supervisor Valley.
Aye.
Supervisor Verboon.
Yes.
Supervisor Peterson.
Aye.
Supervisor Fagundes.
Yes.
Very good. 5 in favor. Thank you. Okay, as we move into the regular agenda items, I'd just like to extend my hopes and wishes that we can be professional today. I know this has been a challenge throughout and people are on edge and there's a lot of issues, but I think for the public. We really need to extend a level of professionalism to everybody that's listening today. It reflects on us as a county and us as county supervisors. And so as we do that, we'll move on into regular agenda items. Item A, Department of Public Health. Ed Hill and Clarissa Ravello.
Yes, good morning. This is Clarissa Ravello with First 5 Kings County. I just want to make sure that you folks can hear me.
You're loud and clear.
Awesome. So good morning, Chair of the Board, as well as other board members. First 5 is here today to request an approval of an agreement. The First 5 Kings County Children and Families Commission is currently a member of a regional training and technical assistance hub for a local consortia that are participating in First 5 Improve and Maximize programs so all children thrive, also known as First 5 Impact, and the California Quality Rating and Improvement System, or California QRIS. Both programs are to enhance the early childhood care and education programs throughout the Central Valley. First 5 Kings initially entered into an agreement with the regional First 5 and county offices of education back in June of 2017, and that agreement was valid until June 30th of 2020, again as part of a regional training and technical assistance hub. In August of 2019, the Kings County Office of Education was also added as a signatory partner, so they are also a part of this Regional 5 Impact Hub agreement. Now that that agreement is has expired, First 5 Commission is requesting that the County of Kings join this hub agreement again for the current fiscal year. We are requesting that the agreement be approved retroactive from July 1st, 2020 through June 30th, 2021. This matter, again, is before your board. A copy of the agreement is on file with the clerk of the board for review, and it has been reviewed and approved as to form by County Council. I am available for any other questions if the board has any.
All right, thank you. Questions from the board?
I'm good. If there's no question or comments, I'll move approval as presented.
Second. Right, we have a motion and a second. Madam Clerk, please call the roll.
Supervisor Neves,
No.
Supervisor Valley,
No.
Supervisor Verboen,
Yes.
Supervisor Peterson,
Aye.
Supervisor Fagundes.
Okay, we have 3 in favor, 2 against. Motion carries. And we'll move on to item B, administration, Rebecca Campbell and Domingo Cruz.
Mr. Chairman, members of the board, good morning. Domingo Cruz, one of your administrative analysts in the administrative office. Can you hear me?
Hear you loud and clear.
Thank you, sir. So this morning, I'm here to request that your board approve the plans and specification and authorize advertising of the Senate Bill 81, Round 2 Juvenile Center Remodel Project on January 12, 2021, which is today. So the plans and specifications are on file with the clerk of the board for your review. On September 3rd, 2020, the plans and specification for the construction project were completed and were approved by the State Fire Marshal. Additionally, the project's working drawing and proceed to bid was approved by the State Department of Finance on January 7th, 2021. That's last week. So this action by the State's Department of Finance prompted us to be in front of your board today as part of the process before we can start construction of the project. The architect's estimate of probable cost for bidding purposes is $9.2 million. Funds are included in the adopted fiscal year 2020-2021 budget. Budget unit 700003. That's the Casey SB 81 project. The account number is 94105, which is SB 81 project. So the state will provide $9,600,000 for the project, and the county is providing $4,193,000 in the form of a cash match. So the county's cash match amount includes $2,063,000 in capital outlay, $1,530,000 in public protection impact fees, $600,000 in Mental Health Services Act capital funds. So the total available budget for the project is $13,793,000. The estimated contingency for the project is about $700,000, which is already budgeted in budget unit 700003. In February of 2020, the county held a pre-qualification process. So from this process, 7 construction companies have been pre-qualified to bid as the general contractor on this project. The list is at the back of your agenda item. I'll mention them. They are Broward Builders, Inc., David A. Bush, Inc., F&H Construction, Seals Construction, Inc., Isleton Construction Company, Stronghold Engineering, Inc., and Zumwalt Construction, Inc. Bids are due to the county on February 18, 2021, and we're anticipating to be back in front of your board on February 23rd, 2021, for the construction contract award approval. It is also anticipated that the start of construction is March 29, 2021, with a completion date of June 28, 2022. Finally, the estimated occupancy date is September 28, 2022. With that, and barring any question, I respectfully request that your board approve the plans and specifications and authorize advertising of the Senate Bill 81 Round 2 Juvenile Center Remodel Project today, January 12, 2021. Thank you.
Okay, thank you, Dominic. Domingo, sorry, Dominic, I know you don't like that. So is there questions from the board? Any comments? I'd just like to say that, this project has been in motion for quite some time, challenging to find adequate funding these days to build these kind of projects but with the move from the state, we know that we're going to have to do this, and so thanks to administration and everyone involved in working through this for a number of years, and hopefully we bring this project to fruition, and we'll see what happens in the bids. But if there are no further questions, would entertain a motion.
If there's no question or comment, I'll make a motion to approve as presented.
I'll second that motion.
Okay, we have a motion and a second. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
Okay, we have 5 in favor. Thank you. We'll move on to item C, administration, and Rebecca.
Lee's gonna take that one. Thank you.
All right, Lee.
Good morning, Mr. Chair and board members. I am here today to present a related item associated with the approval of the Jackson Ranch Development Project at the board's December 8th meeting. One of the concerns about the project, and those concerns are held by the developer as well as others, is that the project may not have as much water as it needs, or may drain from the Kettleman City Community Service District scarce water resources in order to support the Jackson Ranch development. Consequently, they've entered into, and the developer has entered into an assignment agreement with a related party to assign, let me take it back, Sandridge Partners currently receives by contract of the county's state water project Table A Water. Sandridge has offered to support the development by assigning 150 acre feet of water from its state water project Table A Water to the Kettleman City Community Services District in order to make sure that that community and the project development have adequate water supplies for residential, agricultural, and industrial consumption going forward. It's a very simple assignment, and yet because the county is the primary contracting party with the state on that Table A Water, it has the authority and it is a requirement that the board approve the assignment for it to be effective. So what we're asking is that the board approve the assignment of that Table A Water from Sandridge Partners to the Kettleman City Community Services District in order to support that development.
All right, thank you, Madam Council. Questions, comments, thoughts?
Mr. Chairman, Richard Valley, I have my hand raised.
Oh, sorry, go ahead.
Good morning, Mr. Chairman. Mr. Chairman, the question through you to council, just for public clarification, this action that we're being asked to take, this is an action that the board members of the Community Service District in Kettleman City have already taken, or is this something we're being asked to do first and then would land on their agenda in Kettleman?
That's a good question, Supervisor Valley. This action doesn't require action from the Kettleman City Community Service District other than just to accept more water coming through their system. I'll be honest, I hadn't considered that because I was looking at the board's authority and the requirement for this board's approval, but procedurally, I haven't looked into what relative authority that the community service district must take based on their enabling documents.
Okay, thank you for the answer. I guess the follow-up is, I just want to make sure we're not sending a negative, something that would be perceived as a negative action towards the board and the community. And then the second part to that question, council, when you talked about the availability of water, are you going off the 300 acre feet of water, which I believe has been traditionally relayed to us is what that community needs to operate, or has that number changed?
I am unaware of what the current allocation is to the community service district. The idea of the assignment is that that water will continue to be available to that community for agricultural purposes and other purposes. This is intended to augment the amount that would be needed to provide potable water to the development. So the community shouldn't feel the effects of this at all. And consequently should not be detrimentally impacted by not bringing more water into the community and then this approved development drawing down on those resources. I hope that answers your question.
Well, it does to the extent, except for the confirmation on the board members. And the only reason I have the concern is, one, this is an area where I'm very proud of the work that the Board of Supervisors and staff has done over the years, going back even before the 12 years I served on this board, but definitely the last 12 years, what this Board of Supervisors has done for the community of Kettleman has been very positive. The monies that we put in the infrastructure, the water treatment plant, fighting like hell to help them get the funding for the water treatment plant. And I just want to make sure we're not doing anything that takes us 2 steps backwards. That's the confirmation I'm looking for. If any other board member has more information to educate me on that part or to put some confidence in the vote, I'd appreciate that.
Well, Supervisor Valley, what I would say is that administration, the CAO, and I worked very closely with community development as they prepared their project for approval at the December 8th meeting, and then subsequently on the Jackson Ranch ordinance that is on the agenda for later in the meeting. And we've had assurances that this was good and necessary for the Jackson Ranch project to move forward. It definitely is a development to be proud of, and we took it that the board would want to support it in every way. Getting them potable water to support the development is an essential component of that.
Got it. Okay, thank you. Thank you. I have enough information. Thank you.
Thank you.
Mr. Chair, Supervisor Verboen here.
Yes, sir.
So I believe Kettleman City Water District gets an allocation from Wetlands Water, I believe 900 acre feet. This is an additional 150 acre feet, which the only thing it will affect the current users would probably lower their rates because they will optimize the usage of the water treatment facility by spreading the fees out over a bigger pool. So this will probably greatly affect the people that live in Kettleman City. Their water rate should go down once this is in full effect. So I think this is a positive thing for the Kettleman City people. And I don't know how the businesses feel about another business coming down there, but I think there's enough traffic to justify it. So with that, if there's no more questions or comments, I'll make a motion to approve.
Just a minute. Chairman Peterson, Greg Gatska has his hand raised.
Yep, I was going to next. Thank you. Mr. Gatska.
I had to turn myself off mute. Greg Gatska, Community Development Agency Director. Supervisor Valley had asked some questions to Lee Burdick, our County Counsel, and I had some additional information, so I just wanted to support what County Counsel was indicating because County Counsel has been handling a lot of the legal pieces for the water transfer, but we've been kind of coordinating some of the district related aspects, and I was actually just on a call with Joe McGann, the district engineer, right before this meeting. So the item that's presented to you today really is to really get the board's blessing to allow that water transfer to happen. The actual agreement between the Kettleman City Community Services District and the developer is still in works, and their attorneys with the district and the developer are still refining that. This just gives the board's blessing and allowance to allow that to go forward and be refined and make sure it's going to meet both the district's needs, and the developer is intending to pay for that water. That's one of the biggest concerns from the district. So to address and answer Supervisor Valley's question as to whether the district board has addressed this, they haven't yet because the agreement is still being refined and all those details for making sure that the developer pays for the water and how that's going to work is still all being worked out. So that part is still in the works. But this piece is necessary, like County Council's presented to you, to allow that process to go forward. It doesn't obligate the district in their formal arrangements and the agreement with the developer because that's still pending.
Oh, very good. Thank you, Greg. And while you're online, Greg, I have a couple questions, and I think, we always want to support, new business development in our communities and the opportunity for increased tax base. The other question is, and I know water is traded on a daily basis, and this water would just go into another pool that can be moved and manipulated. I just always have the concern, here we are in a very dry region with no shining light at the end of the tunnel on new water coming into the area. As a matter of fact, we're losing more, and so every drop of water that comes in as an agricultural input is vital. I'm just wondering how we value that. As a development. They're going to cover, any development in California is required to find their own water supply and do that. And I'm just curious how we justify that in today's environment.
Yeah, that's a very, very tricky situation because obviously the water rights aren't controlled by us as a government, and the individual ownership of those rights can be sold or transferred out. And we've seen quite a bit of that being transferred out of the area. You know, the agricultural water is necessary for agricultural production. Luckily, we have a situation here, though, where agricultural interests want to invest that in some of the urban development that will ultimately benefit the county. So that's kind of a positive. I know it's a loss to some of the agricultural water use, but it's a positive in the sense that water will now be dedicated for urban type use that's for commercial development within the county versus actually getting transferred or sold out of the area to some other jurisdiction. So there's always a trade-off, but we try to encourage that those water resources be kept here as best or as reasonable as possible, even though we don't have direct control over what private water right interests do with their water rights.
Yep. Well, you know, I agree. I think that, you know, again, development is important, but you know, we also need to practice what we preach when it comes to you know, water issues and the support of our largest industry, which is agriculture. And I know it's a small portion, and again, you know, with state water supplies, it's easily traded and moved. But you know, I just kind of believe that we should do everything in our power to make sure that water stays in our district, and it sounds like it is. And you know, but again, I think the responsibility of a new development is, you know, should be placed on them. And I know this water is not going to be free. I guess where it's going to be sold, and so thank you for your comments. I know we have a motion on the table. Is there a second?
I'm sorry.
I'll second that.
Supervisor, or Mr. Chair, I did not make note of who brought the motion.
Supervisor Verboen. Am I correct, Doug?
Yes, sir. Yes, Mr. Chair.
Thank you.
Okay, we have a motion and a second. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
Very good. We have 5 in favor. Use it wisely. Okay, on to item D, administration. Rebecca and Domingo.
Good morning, Mr. Chairman, members of the board. There's a number of appointments this morning on the agenda. I'm going to start going through them. So the first one is an appointment to the Kings County Water Commission. The purpose of the commission is to request of the Board of Supervisors to investigate and study designated water matters affecting Kings County and report and advise to the board on its findings, and to advise to the Board of Supervisors concerns on water matters which are proposed to be enacted under state or federal legislation. So on that, membership of the committee consists of 9 members. 7 are appointed by the Board of Supervisors, 1 from each supervisorial district, 1 member at large, 1 member representing the Community Services District, Public Utility Districts, and the final 2 members are appointed by a city selection committee. The applicant is Michael Newton, and this would represent the District 1 representative. The application is attached, and Michael is a farm manager from Stratford, and the request is to appoint him as the District 1 representative. Pursuant to board policy, administration makes no recommendation on who. So I would turn that over to the board.
Mr. Chair, Neves moves to appoint.
I'll second. Verboen.
Okay, we have a motion and second. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
Okay, we have 5 in favor. And Rebecca, I don't know, I'm picking up, you're a little muffled. So maybe if you try a little closer, I don't know if that's the issue or not, but please go ahead.
Okay. The next appointment is to the San Joaquin Valley Unified Air Pollution Control District Citizens Advisory Committee. So the purpose of this committee is to provide a forum for a purpose of facilitating public input relating to actions and decisions of the Unified Air Basin Authority. The membership consists of 6 members, 4 appointed by the Board of Supervisors. So 1 member represents the agricultural industry as primary, and 1 member is representing the agricultural industry as the alternate. 1 member representing environmental interests as primary, and another member as alternate. And then the city selection committee will select 1 member as primary and 1 as alternate. So the applicant is Laura Brown to represent the primary member for the agricultural industry. The application is attached. Laura Brown is an environmental resources manager, and administration pursuant to policy makes no recommendation on who the applicant is.
Thank you, Rebecca. So do we have a motion?
I make a motion to approve Laura Brown to the San Joaquin Valley Air Pollution Control District.
Second.
Okay, and that'll be to the CAC. So all those in, or CAC or whatever it is. All those in, oh, no, excuse me. So we have a motion and a second. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
Okay, we have 5 in favor. Back to Rebecca.
Okay, the next appointment is for the Teens Early Education Planning Council. The council is a countywide advisory board created to address child care needs and coordinate services of families who are seeking or currently receiving subsidized and/or subsidized child care services. The criteria for appointment: applicants must meet the specific representation of the position for which the vacancy exists. The applicants are Michelle Dove, a child care provider; Clarissa Ravello, public agency representative; Deborah Gibson, community representative; Susan Philpott, community representative; and Courtney Coelho, public agency representative. And so the advisory board does recommend those appointments, and administration makes no recommendations pursuant to policy on who. I'll turn it over to the board. All of the applicants.
Thank you. Board, what's your pleasure?
I'll move as presented.
Do we have a second?
Second.
We have a motion and a second. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
Okay, we have 5 in favor. Thank you. On to the next committee assignment.
Okay, so the next one is a little different. This is the annual item that comes before the board once we change calendar years, and it's a 2021 board and committee assignment. This schedule has been given to your board members to review, and so board members have an opportunity to look at it and see if there's any changes. The county clerk has invited individual board members to go over if there's any changes to the committee. One change this year is that the Economic Development Committee is no longer being a committee, so that was removed. And so I'll turn it over to your board to see if there are any recommended changes and ask for adoption.
Chairman Peterson, Richard Valley has his hand raised.
Yep. Go ahead, Supervisor Valley.
Thank you, Mr. Chairman. Mr. Chairman, just for clarification on the appointment to the KCAO Board of Directors. There seems to have been some confusion over the last couple of weeks on that. If we can get some public clarification on that. we were told publicly a couple of weeks ago during the board meeting is that was an open seat for an appointment to that board. One of the board members actually suggested I take an interest in that. One, I would love to do so. However, over the break, there was a couple of emails that came back and forth that suggested that was never an open seat. And it causes some public confusion because the KCAO website lists Supervisor Verboon as the member to that board, and we're being told that he's not the appointment either. So can we just get some general clarification on that appointment? It's a very important appointment, and that organization needs a lot of work, and I'm ready to roll up my sleeves and go to work over there. Thank you, Mr. Chairman.
Thank you. Rebecca, do you want to respond to that, or is there someone in?
I can respond to it. As stated on the proposed board committee assignments document, the understanding is that Supervisor Fagundes will remain as the primary appointment, and Supervisor Verboon will be the alternate.
Mr. Chairman, that doesn't explain for the public. So I can ask the CAO then if she knows why that was not the case on the website. Why was another board member listed on their website as having the appointment from the board to that KCAO board of directors?
What I understand is that Supervisor Verboon was filling in at the time, and I would ask, I don't have any further details than that.
Yeah, so that's the lack of the clarification there. Mr. Chairman, is Supervisor Fagundes, he's still interested in serving on this board of directors?
Mr. Chairman, Supervisor Fagundes, yes, there was a little bit of a misunderstanding on that. And I had to step down here for a couple of meetings, and Supervisor Verboon took it for me. And since then, I'd like to continue on that board.
Thank you.
That's all I needed, Mr. Chairman, was a clarification. I'm happy to support Supervisor Fagundes on that board to continue to serve there. Thank you. Okay.
Any further discussion? If not, entertain a motion to accept the nominations.
I'll make a motion to approve as presented.
I can't.
Okay, we have a motion. Okay, thank you, Supervisor Valley. Madam Clerk, please call the roll.
Supervisor Debs?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboon?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
Very good, thank you. 5 in favor, motion carries. Rebecca.
Yeah, so the next item, Domingo Cruz, Administrative Analyst, worked on this item, so he's going to come forward and make a presentation. Thank you, Domingo.
Thanks, Rebecca. So, Mr. Chairman, members of the board, good morning again. I'm here to request that your board approve the 5-year impact fee report prepared by David Tossig and Associates, Inc., or DTA, to continue collecting the fees at the building permit stage in development. So attached to this agenda item is the final copy of the 5-year impact fee report for your review. As mentioned in the impact fee public hearing on September 14, 2020, the 5-year impact fee report was then being finalized. So due to competing priorities as a result of the COVID-19 pandemic, we are now just able to bring this item to your board. As required by law, which is the Mitigation Fee Act, Government Code 66000, a 5-year developmental impact fee report must be completed in order to continue to collect the fees at the building permit stage of development. So the administrative office entered into an agreement with David Tossig and Associates, Inc., or DTA, and January 21st, 2020 for the current and third 5-year impact fee report. The report is for fiscal years 2015 to 2016 through 2019 to 2020, which includes the information and proposed findings for the impact fee, public hearing, and final approval in August of 2021 during the county's annual budget hearings. So on your agenda item under fiscal impact, there's a table that shows the current fees on hand and cost of future projects. Under public protection, the fees on hand as of June 30, 2020 is $3,209,687, and the cost of future projects is $14,426,105. Under fire, the fees on hand as of June 30, 2020 is $1,545,704, and the cost of future projects is $1,463,535. Under the library, the fees on hand as of June 30, 2020 is $1,765,412, and the cost of future projects is $2,190,350. So under animal control, the fees on hand as of June 30, 2020 is $12,741, and the cost of future project is $309,800. Under the sheriff patrol and investigation, the fees on hand as of June 30, 2020 is $154,515, and the cost of future projects is $3,466,187. Under the administration, the fees on hand as of June 30, 2020 is $21,021, and the cost of future project is not applicable at this time. There's no identified project. Also, on the agenda item, the second page shows a detailed list of future projects which are expected to start within the next 5 years. This is also located at page 5 of the report. If you recall, your board also approved the listed projects during the impact fee public hearing on September 14, 2020. The list shows the approved projects, the estimated funds needed, and the total cost. The estimated funds needed are the impact fees and other sources. On the other sources column, that could be either from the county general fund or grants from state or federal agencies. As an example, today is the SB 81 that was presented earlier. We had grants from the state, the 9.6 million, and the some of the impact fee, and from the MHSA capital funds. So as mentioned above, these projects will be again incorporated into the construction schedule that will be brought back to your board in a public hearing during the county's annual budget hearings in August of 2021. Also, a representative from the DTA is on the line if you have specific questions for them. With that, I respectfully request that your board approve the 5-year impact fee report prepared by David Tosig and Associates, Inc., to continue collecting the fees at the building permit stage of development. Thank you.
Thank you, Domingo. Questions, comments? There are none. Entertain motion.
I'll go ahead. If no question or comments, I'll make a motion to approve the 5-year impact fee report as presented.
Very good. We have a motion. Is there a second?
I'll second that motion.
Okay, we have a motion and a second. Madam Clerk, please call the roll.
Supervisor Neves,
Yes.
Supervisor Valley,
Aye.
Supervisor Verboen,
Yes.
Supervisor Peterson,
Aye.
Supervisor Fagundes.
Yes.
Okay, we have 5 in favor. Awesome. Okay, now we'll move on to item E, administration, and back to Rebecca. You're on mute, Rebecca.
Okay, I made an adjustment on my audio. I hope it's coming across better. Okay, so the next item on the agenda is the weekly item regarding the novel coronavirus pandemic. There was a number of activities that happened last week, so I'll start by going over that, talk about the county, and then I'll turn it over to Director Ed Hill for a local public health update. So the last update that was given to your board was on January 5th of 2021. This past week, the governor has been on several times talking about statewide actions. He acknowledged that the California's pace of COVID-19 vaccine administration is not good enough. As of January 3rd, nearly 1.3 million doses had been distributed, and also made a commitment that they wanted to push out another million over the last week and this week. So to help address the vaccine issue, the governor announced that he would propose $300 million in fiscal year 2021-22 state budgets for vaccines. The funding would be used for technology, including upgrading the CalVax system, logistics, including transportation, containers, dry ice, freezers, etc., and also a public education campaign. They're looking to expand the pool of individuals who could administer the vaccine, including dentists, pharmacy technicians, the National Guard, pharmacy programs, and clinic and doctor partnerships. Dr. Erica Pan noted that the state plans to allow for greater flexibility within the priority structure, such as allowing smaller jurisdictions to offer the vaccine subsequent to priority groups once it has moved through the current phase. So the state is rolling out, as of last week, phase 1A. And the Director Ed Hill will talk a little more about that. Also, the California Department of Public Health released a statewide public health order on last Tuesday night on the hospital surge. The order, which was effective immediately, remains in effect for at least 3 weeks, ordering hospitals and surge centers to halt non-essential and non-life-threatening procedures in counties where the ICU capacity has fallen to 10% or below, and the regional capacity is at 0%. Additionally, the order requires hospitals statewide to accept transfer patients from other facilities that have no room left to treat them. The non-essential procedure portion of the order is effective for the following counties: Fresno, Imperial, Kern, Kings, Los Angeles, Madera, Merced, Orange, Riverside, San Bernardino, San Benito, San Diego, San Joaquin, and San Blas. And the order was amended on January 6th to exempt children's hospitals from the non-essential procedure provisions. Last week was a big week for the governor announced the state budget. He gave a press conference on Friday about that, and it was nearly almost 5 hours of him speaking about the budget. So I want to go over a few things about the budget. It was a lengthy press conference, and he announced his proposed 2021-22 state budget, highlighting dramatic differences from 2020. We're still in the pandemic. So this budget includes COVID-19 funding for vaccines, safely reopening schools, support for small businesses, money in the pocket of Californians, and wildfire preparedness. The governor outlined a considerable number of proposals in detail during that press conference. The budget proposes $14 billion in early action proposals starting in January. So this is a little different from in the past. He's proposing that the legislature take action sooner than later. Also in March, and the full budget enactment in June. The governor has proposed $5 billion immediately, action as of January. Package as follows: $2 billion for reopening schools safely, $575 million for small business grants, $71 million for fee waivers for small businesses, $2.4 billion in a Golden State stimulus program, and federal funds eviction moratorium guidelines. Among the number of items, the budget includes $4.6 billion in Prop 98 for extending learning time, including summer school and other strategies to address the pandemic's impact on the learning loss. To provide additional planning time for districts, the administration is proposing early action by the legislature this spring to approve these funds. Also, a number of items related to COVID, as the governor proposed $14 billion in a recovery package that includes several proposals geared towards supporting businesses and including for individuals and job creation, both during the pandemic and as the state recovers. The administration is proposing that the legislature take action in early 2021 on the majority of that package. Also requested for immediate action is the $575 million for the small business and $500 million already approved in the state small business COVID-19 relief grant program. A little bit about the Golden State Stimulus. The governor proposes a Golden State Stimulus program, which is a tax refund of $600 intended to provide rapid cash support to 4 million low-income Californians who are eligible for California Earned Income Tax Credit, including those undocumented households and who file taxes with an individual taxpayer identification number. Seeking action on that in January. The governor's budget dedicates a full chapter to the state's COVID-19 pandemic response over the past year. Notably, the 21-22 budget includes more than $300 million in initial estimate of vaccine distribution, including a public awareness campaign to increase the vaccine adoption. Also in there is the state prison systems had to make dramatic changes to its operations as a result of the pandemic. Intake of sentenced felons from county jails was suspended in late March. We've been hearing about that from our local sheriff, and that resumed on a limited basis in August and again halted in late November due to the ongoing surge. So intake will resume with continued precautions, testing upon intake and 2-week quarantines in reception centers as public health conditions allow. The governor's budget proposes $38.8 million in reimbursements to counties for holding state inmates during intake stoppage, and that has been made as of December 1, 2020. An additional $40.4 million in payments were pending, and current projections indicate that a total of $163.4 million in additional reimbursements will be required to cover the cost through June 30 of 2021. The budget includes $2 billion, so $450 to $700 per student in current Proposition 98 funds in financial incentives to support school safety measures, including testing, ventilation, PPE, and those schools that have resumed in-person instruction or have planned to phase in-person instruction by early spring. So what's next? The full budget committees in each house are starting to meet in an overview of the governor's proposed spending plan. Since the administration is seeking action early on a number of its proposals, we do anticipate that the subcommittee hearings will start and you'll see a lot of action on that very soon. Trailer bill language to implement various budget proposals are due typically February 1 to the legislature, but I would expect those sooner. On the federal side, the U.S. Treasury released information about the $25 billion emergency rental assistance program, including the last December's COVID relief and omnibus spending package. California is slated to receive $2.6 billion, and counties and cities with a population of over 200,000 and above are eligible to receive a direct allocation from the federal government. Kings County does not qualify for that. Okay. On the county side, the county does continue to operate mitigating exposure contacts. So a number of departments, virtually almost all of the departments are have some form of teleworking within their departments and serving the public in different way to mitigate the spread of COVID-19. Included in this agenda item is an update to the face mask policy, bringing that policy in line with state mandates and also the employee protocols. basically saying that the mask shall be worn when you are in the building. Okay, at this time, I will turn it over to Director Ed Hill for a public health local update.
Good morning, Mr. Chairman, members of the board. Ed Hill, Public Health. I'd like to start off my report, as I always do, by reminding everyone the simple steps we can take to protect ourselves from communicable diseases such as COVID-19, and they are wash your hands frequently for 20 seconds or more. Don't touch your face with unwashed hands. Stay hydrated with water. A hydrated cell is a healthy cell. Stay home if you are sick. Again, this is a big one, especially during allergy and cold season. Individuals think they just have the allergies or cold, then they test positive 2 to 3 days later for COVID-19. Wear a cloth face covering to protect yourself and loved ones. Our current data numbers for this week, I'd like to also open up with CalReady, the state's reporting system was experiencing data issues last week that added some confusion, and we ended up putting up a number of 571 of new cases. That was misunderstood, and we did not put a disclaimer up there until after that number was posted. It was seemed as though the county had increased by 571 cases in one day. That actually wasn't the case. That was a cumulative total over 3 days. It looks like that the CalReady data issue has been fixed right now, and that the data is flowing again. Our current numbers tested, we've collected 137,451 samples. We currently have 1,620 results pending. We're currently monitoring 7,578 individuals. Our current total cases since the outbreak began is now at 11,046, with unfortunately 95 deaths. Total recovered so far is 5,502. Our active case count is at 5,449. Skilled nursing facilities, we've seen a small increase. They are now at 238 with 9 active cases, 203 recovered, and 26 deaths, unfortunately. The outbreaks at the prisons continue. The total between the 3 facilities, 7,267. That's 917 at Corcoran, 3,260 at Avenel State Prison, and 3,090 at SADF. They have collected 92,302 samples. They have 1,377 results pending. Their current active case count is at 2,129. They've recovered 4,751, and unfortunately with 15 deaths. We know of 2 individuals that are hospitalized, but we don't know their location, whether they're hospitalized in another county or here. They usually, as mentioned in the past, Adventist Health Bakersfield has the contract with the state prisons, and that's where they are usually hospitalized. SADF, as mentioned last week, has continued to level off. However, Corcoran continues to see a spike in their cases at that facility. Again, our biggest concern is healthcare surge, and we continue to monitor that very closely. On that note, we continue to see increases in admissions both in regular med-surg and intensive care. Yesterday, the hospital reported they have a total of 88 COVID patients with 12 in the ICU. Also, the Porterville alternate care site, the patient census at that facility as of yesterday is 8 patients. Again, this facility can take up to 25 patients. And the Fresno alternate care site, this is a non-COVID site, has 10 patients. Again, those censuses aren't very high, which is a good indication that the hospitals seem to be handling the surge, but we are keeping a close eye on that. CCMSA, our local Emergency Medical Services Authority, also announced that the state has given paramedics and EMTs the ability to give vaccines, which is a positive. We will look forward to taking advantage of this opportunity moving forward. We are currently still maintaining a 60-day supply of PPE for all of our healthcare facilities. The hospital has received staff from the state. So far, they have received 5 ICU nurses and 5 med-surg nurses. They're also supposed to receive additional staff this week. We don't know the exact numbers right now, as that information is late, not only getting to us, but also getting to the hospitals. But they are anticipating also receiving hopefully some respiratory therapists this week. During the last report, I indicated the state would likely be issuing another state health officer order. Ms. Campbell already covered that. That order was executed on January 6th, so I won't get into those details. Our mobile testing site was at the county facility yesterday. It's at Avenel High School today, Armona Library on Wednesday, Lamora High School on Thursday. Saturday it will be at downtown Hanford. Sunday it'll be at the Corcoran Rack. Monday, again at the county complex on Lacey. Tuesday at Avenal High School, Wednesday at Armona Library, and Thursday at Lemoore High School. We continue to hold regular scheduled follow-up calls with the State Unified Support Team, and they provide resources that they can, as well as clarification on items throughout the state and the moving targets that we are constantly trying to hit. Our current numbers for the state metrics this week, our new cases per 100,000 is at 72.2. That's our adjusted amount. The unadjusted amount is at 84.5. Again, we get adjusted down because the number of tests that we're conducting, we are back again testing over the state average or median, which I'll discuss in just a little bit. Overall testing positivity is at 18.1%, and our testing positivity in the lowest quartiles of the Healthy Place Index is now at 20%. This again means that all of our metrics still meet purple tier criteria, and our test per 100,000 has started to recover. As if you recall, during the last report I mentioned that they had dipped drastically secondary to the holidays. We are now at 572 tests per day, and we anticipate, given the numbers that we're seeing yesterday and this week, that those will continue to increase. The current ICU capacity for the San Joaquin Valley today is at 0%. I'm going to switch into vaccine update. It was a busy weekend for public health, focusing on the many changes that the state is implementing for vaccines, and public health staff worked hard all last week getting ready for yesterday and this week. Over the weekend, we created a COVID-19 vaccine survey in both Spanish and English. This survey is at the top of our main COVID page as well as our vaccine page. And the survey went live Sunday night. We've already received 568 surveys. This survey will be important moving forward, as we will use this survey to reach out to individuals when we start moving into the separate phases, such as Phase 1B. Phase 1B, which is the next coming phase, I'll get into further details later on, but that's where we start getting into the general population, the 75 and older, food and agriculture, things along that line. So it's important that we publicize the survey as much as we can and we get it out. We also updated our webpage, making it easier for people to find information about the vaccines. We established a new call center and vaccine phone line for people who are eligible to be vaccinated to call and make an appointment. I also need to make sure that I take this opportunity, because this was only possible because of my staff and the staff from IT who got all the phones, phone lines, phone systems, and computers set up over the weekend, and they continue to support it right now. IT has basically moved into our building. I can't thank John Devlin and his team enough for the support during this event. We also scheduled as many people as we could for this week, and we will have a successful first couple of days, thanks from help from Dr. Lewis and Sonia, who worked with us over the weekend again to help us schedule the respective providers that are now eligible for the vaccine. We also created new graphics that can be shared on social media. I shared those with folks on the EOC call, as well as several board members, and we're working with our local community-based organizations to also push that information out. I also need to note that I'm extremely proud of public health staff over the last weekend, as this staff worked from sun up to sundown to get ready for this week. This was necessary, secondary to CDPH and the governor's demands on vaccine distribution. They created this tiered approach, which was extremely slow, and I do have to give them credit for lessening the reins and letting us move a little bit further down this process. However, I don't think it's enough. Only time will tell. We thought they had actually released the reins completely and let us go. They released expanded vaccine guidelines on Saturday morning, which included not only all healthcare, but also others who support the healthcare industry, which would make it easier to distribute the vaccines. Based on this, our department went into overdrive and started making calls and scheduling as fast as we could. Unfortunately, the state held a call that same night, Saturday night, and announced that the guideline was published too early, and they took it down. Obviously, all the health departments were unhappy about this, but this really affected us, as we essentially lost an entire day's worth of work that we had to turn around on Sunday and take back and replan for. And what will drive us even further is hopefully the state will finally announce that change within the next day or two, which is going to help us move through the phases much quicker. So what's going on right now as far as vaccines? Phase 1A, Tier 1. This is acute care, psychiatric and correctional hospitals, skilled nursing facilities, paramedics, EMTs, and dialysis centers. They are all getting their second doses this week. So this is a group that was already vaccinated last week or 2 weeks ago, and they are now receiving their second dose. Tier 2, which includes intermediate care facilities, home health and home support services, community health workers, public health staff, and primary care clinics, including federally qualified healthcare clinics, rural health centers, and correctional facility clinics and urgent cares are all being vaccinated now, as well as all specialty clinics, laboratory workers, dental offices, pharmacies not in the higher tiers such as hospitals, and persons working with mortuary services. So we're working hard starting Sunday night and yesterday to get out the message that these, basically all phase 1A is now eligible for vaccination. We want to get through this population as fast as we can, and we want to administer as many of the vaccines that we have on hand. Fortunately, with all the work that was done and to show how fast and how great our staff moved, we were able to vaccinate 120 individuals just by working hard and getting the word out Monday morning. We're hoping to see bigger numbers this week. I'd like to reach at least 180 to 200 vaccines a day as we move forward. We are looking at other operations as we start moving into the other phases. Phase 1B will be the next phase after the last tier that we are in phase 1A. And this phase is 75 and older, food and agricultural, education and child care and emergency services. I've already started calling and making discussions or having discussions with all of these agencies, getting them prepared. As we expand our processes, our plan is to open our respective clinics. We have clinics in Lemoore, Avenal, and Corcoran that we use on a temporary basis for work services, but we will be standing them back up full-time 7 days a week for vaccinations as soon as we move into these other tiers, which we anticipate we may be moving into phase 1B by the end of this week, early next week. I'd also like to take this opportunity to conduct some rumor control because we're hearing a lot of rumors about other counties that are vaccinating the general population, which is not the case. One of the issues that drive this is, for example, I heard a radio story this morning where the reporter announced that the Valley has begun to enter phase 1 today, but then later on indicated that that was happening in Mariposa County. I want to assure the board as well as the public that I've been in constant communication with our neighboring counties, and none of them are close to entering phase 1B yet. Another issue that some of these counties up and down the state are encountering is some of the clinics and hospitals have received vaccines and they are vaccinating, and we have zero visibility into their processes. And there is a chance that individuals may slip through the cracks and get vaccinated early, but that we have not seen that happen here, or that has been reported to me from other counties. But if you recall, I made it very clear that we will encounter these challenges as we move forward, and we'll address them as they come up. And then I would also just like to remind everybody again that this moves extremely fast, and the state changes their processes frequently. Sometimes they're for the good, sometimes they're not. This is one that's for the good because we do want to get this vaccine out and get it into the hands of the public. I'm going to go ahead and conclude my report there and answer any questions.
Thanks again. I know you guys put in a lot of effort this weekend, and not unlike any other weekend, some frustration involved in that. And again, thanks to everyone involved in the effort to go forward. Questions from the board?
Yes, Mr. I'm sorry.
Go ahead, Supervisor Valley.
Thank you, Mr. Chairman. Question to Mr. Hill. Mr. Hill, just some of the confusion going around in the news stories that I'm reading up and down the state. Can you just clarify, at least for Kings County, where do farm workers fall under the vaccine, the tier system? At what level do you see farm workers eligible for the vaccine? Thank you.
Thank you, Supervisor Valley, through the chair. They are in phase 1B, tier 1. And they are the second bullet down. So it goes 75 and older, which is the first bullet or the first population of interest when we enter phase 1B. And then it's food and agriculture. And by food, they mean large processing plants and then agriculture. I've already had one call with Mr. Hook, our Ag Commissioner, Dusty from the Farm Bureau, as well as Lance Lippincott from JTO. We're starting to put that media campaign and that process together. We hope to have further discussions with them and start rolling them out rolling those discussions with the larger organizations, hopefully this week. Again, we anticipate we may be able to move into phase 1B at the end of this week or early next week. So it's not far out. Again, it's going to be a heavy lift and it moves very quick. So and it's all dependent on vaccines. As I've reported in the past, and I'm sorry I didn't cover that during my report, we don't have a lot of good intelligence coming from the state and the feds. 1 week we are told we're getting 100 Moderna, and then we get 100 the next week. We're told we're getting 100 Moderna and we get 500. And then the following week we're told we're getting 500 and we get 100, and it's the same for Pfizer. And it makes it really difficult to plan. But again, I anticipate moving into phase 1B as early as hopefully the end of this week or the end of this week and early next week.
Thank you for the update, Mr. Hill. Thank you.
Cool. Other questions from the board? If there's none, Ed, I have a couple questions. With respect to vaccine availability and in the county, it just seems like, I know you're kind of one of the central points for distribution. And I mean, I know you've developed this list. Is that list coordinated with other facilities in the county? And how do we, ensure a fair application and opportunity in the public with respect to that?
Thank you, Chairman Peterson, through the board. We do, and I also apologize, I should have included this in my report. We are working with a couple of the local clinics to help with the vaccine distribution. ARIA has stepped up and said that they will help with the distribution. There's a lot of planning that needs to go into that, as into when do they start, what population will they start helping us vaccinate, how often can they vaccinate, and how many clients can they handle in a day. So we're working with them. The state will likely introduce a health equity metric for vaccine distribution, similar to the one that they did for the testing and the roadmap or the blueprint for reopening. And we're anticipating that to come out any day now. Until then, we will continue to plan using the lowest quartile of the Healthy Places Index to prioritize our vaccinations. Again, that's why I'm going to put a lot of emphasis and urge individuals to go and complete that survey online, because that's where we will start. Those that have identified that they have an interest in receiving the vaccine will be where we will be our starting point. We will focus in the rural areas as dictated by the California Department of Public Health and the rural health clinics, again, using this opportunity not only to vaccinate their staff, but also to bring them on board as partners and distribute that. I'm not sure that answers your question. If it doesn't, I can dig deeper.
Yeah, and I just from the standpoint, I mean, we want to pull the wagon together in our county, and I understand now you don't have actual vaccine numbers that go to the various agencies and businesses that are available to provide the vaccine.
Chairman Peterson, through the board, that is correct. We are allotted our allocation. We vaccinate the current tier and population until nobody is interested in being vaccinated anymore, and then we move to the next population.
And so then when, let's say, for instance, and I guess would be in the instance of the hospital, I know we've shared vaccine with the hospital, but they also get a direct supply.
So our local hospital, we originally gave them 700 vaccines. Originally, the state and the feds thought that they would be distributing vaccine to what's known as a multi-county entity, or MCE, which Adventist Health is. The conditions for that is they have to be a hospital system that operates in multiple counties. Again, they are, but unfortunately, their initial allotment for the MCEs was not ready when it was deployed. So the state pivoted, as they often do, and asked the locals to provide them with those initial doses, which we've done. And again, that was 700, and then we've also given them their allotment for their second dose. But they should be receiving their remaining doses through the MCE program. If not, the state will likely pivot and ask us to support them. Also, this is an opportunity to remind the board, as well as everyone else, we're seeing a lot of declinations or denial are declining receiving the vaccine, and that's happening throughout the state, not only locally, but throughout the state. And so there doesn't seem to be a shortage of vaccine for the the hospital system at this point.
Okay, I just want to make sure, I know we've done a lot of work on this list, and thank you for that over the weekend. I know I went in and put my name down wherever it falls down on the list there. But so the question would be, if we're required or requested to provide more vaccine to the MCE or to the hospital, and they have a list and we have a list, how do you assure that those that have got in line, so to speak, are equitably and timely treated based on their entrance into that list?
Thank you, Chairman Peterson, to the board. Again, it's basically based on vaccine availability and directives from the California Department of Public Health. So if the California Department of Public Health, again, requires us to distribute additional vaccines to the hospital, we're compelled to do so. Other than that, we will continue to move through this process using that survey as well as wide marketing. As I mentioned, so far we've collected close to 600 responses through that survey just from it going live yesterday. And just to put it in perspective, when it comes into the movement into Tier 1B, that is the 75 and older classification, currently there are only 20 individuals on that list. So right now, we don't have a vaccine inventory problem. We have an acceptance problem. So I'm not sure if that answers your question.
Yeah. No, it does, and acceptance and awareness, I think, are I think Supervisor Valley has pointed to that in the past. That I know that each of us in our different mediums have made that effort. I will share one experience, and I went back, and after I had applied or went in and applied on the list, and I heard from someone that they went in and they mistakenly put a phone number in, and then based on me, and I said, well, I'll go back and see. I went back and tried to reopen my application, and I couldn't to change anything there. I'm just curious, when you look at that population that is not as comfortable with computers as some, making sure that list and the ability to correctly, or to correct what's on that list should be something that is available, and not a criticism, but just an oversight that I've seen with that. And I know I'll let you respond to that, and then Supervisor Neves has his hand.
Thank you, Chairman Peterson, through the board. That is correct. We are using the survey as one tool. As mentioned earlier, when we reach phase 1B, we will not only use that survey, but we will do a large media campaign getting it out so that everybody that is 75 and older knows that they are eligible to get the vaccine. We knew that we would encounter individuals that either don't use the system or unaware of it, so that's why we have that other option in place to do mass promotion for that population.
Yeah, thank you. Supervisor Neves.
Thank you, Mr. Chair. Mr. Hill, this is a series of immunizations, and it doesn't appear to be located on the interest form, or I think some of that information is somewhat lacking. Could you talk about the need of receiving a second shot within a specific time frame to make sure everybody knows that this isn't just go in and receive a single flu shot? This is a series, almost like the hepatitis type series of immunizations, and kind of address that as well. Thank you.
Yes, thank you, Supervisor Neves, through the chair, and that's an excellent point. We'll go ahead and adjust the surveys to make sure that that's explicitly explained in there, as well as make sure that our website is updated to cover that. Each vaccine requires a total of 2 shots. The first shot is, of course, given when the individual is eligible. And then the second one, depending on the manufacturer, Moderna or Pfizer, is to be given within 28 days for the Moderna vaccine and 21 days for the Pfizer vaccine. Once you receive that second titer, you are considered vaccinated. It is still possible after you get the first vaccination or the first shot for you to get the COVID-19 virus, and you're not considered fully protected till the second one. Just as Supervisor Neves mentioned, many of the other vaccines like hepatitis and other vaccines. Thank you for pointing that out. We'll make that necessary adjustment.
Thank you. Any further comments by the board, questions?
Yes, Mr. Chair, just one more quick one, if I may, to Mr. Hill. Mr. Hill, I see that now you have a standard day set where communities can expect the mobile testing unit coming. Is there a day that you have that can be random for that unit to hit the Stratfords, the Home Gardens, the Kettleman City, or is the strategy that those smaller communities need to make the effort to get to the nearest a larger community where that testing site is? Thank you.
Thank you for the question, Supervisor Valley, through the chair. That's correct. We can take a look at that schedules and give them the opportunity to have that unit posted there. And then, of course, when we do that, we'll closely monitor testing volume. There are also other testing options that we can start looking at instead of just the large mobile unit, depending on volume. So I don't want it to be misunderstood that if the volume doesn't exist in those smaller communities, because the likelihood of it existing is smaller, obviously, because it's a smaller community, but we can come up with other testing options. So we'll take a look at that and report back to you next Tuesday.
Very good. Thank you. Further questions, comments? Okay. Well, thank you. Rebecca, are you completed now?
Yes, I'm completed. I do need action on the Facebook policy. Facebook, I mean the face mask, face mask, not Facebook.
Yeah, there's a lot of people wondering about Facebook these days. So
I know, right? It's stuck in your head. So yeah, so I would request that the board approve the updated policy for face coverings. Thank you.
Very good. Very good. Questions, comments?
Mr. Chairman, a question on the language.
Sure, go ahead.
Thank you, Mr. Chair. Shoot, I just had it up in front of me. And anyways, there's a red line stricken on the language that said that before, where an employee found themselves in their own private office, they could remove their face coverings. That language is stricken now. Just for clarification, does that mean that if you are alone in your own private office, you still, per county policy, need to wear a face mask?
Yes, that is correct. If you are in the building, you are required to wear a face covering. If you cannot, then you must ensure that there's physical distancing implemented. This goes back to state guidance that was adopted on June 18th. Inside of or in line to enter any indoor public space, it is mandated for employees to wear face coverings.
Okay, so just to lead by example, that pertains to administration as well, correct?
Correct.
All right, thank you. Thank you, Mr. Chair.
Okay, thank you. Further questions, comments, or entertain a motion to accept? Is this thing on? All right, any further, is there further discussion on the item?
Well, Mr. Chairman, you're looking for a motion to pass the modification, correct?
Yes, sir.
Okay. Well, yes, Mr. Chairman, I'll move to pass this policy as presented.
Thank you. Is there a second? Rebecca, in the timeline we have here, and second, this is something that has been mandated by OSHA as well, right? I don't know. We just took I was reminded that I hadn't taken my OSHA document planning COVID coverall. So this is a mandate by Cal OSHA, right?
That is correct. There was a statewide order on June 18th. Also, the new OSHA guidelines that have come out and regulations that we are all trying to adhere to. So just bringing up all of our documents, we have a guidance policy, we have employee protocols, and then we have this face covering policy that was brought to our attention that needed to be updated to make sure that everything is matching and in place with state guidance.
Thank you. So with that, at this point, I'll take chairman's prerogative and second the motion to see if we can further discussion. And so at this point, we have a motion and a second. Madam Clerk, would you please call the roll?
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
No.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
No.
I think we have 3 in favor, 2 against. Motion carries. Okay, we are past 10 o'clock. We do have a public hearing scheduled from community development. So at this time, I would ask Mr. Gatska to present the item.
Good morning, Chairman, members of the board. Greg Gatska, Community Development Agency Director. And here to bring you a follow-up item in relation to the Jackson Ranch specific plan that we presented to you back on December 8th. And this board did approve that for integration into the general plan. This is the follow-up item to make sure that we're presenting the ordinance piece correctly to you, which requires 2 readings. So this, thanks to County Council working with us, we're bringing it back to make sure that we've got that done correctly. And so the proposed ordinance was presented to you back on December 8th, and now we're bringing it to you to hold a public hearing on that item and have you consider it for the first reading, which is proposed ordinance 668-2-20. And in summary, that is the development code text change for the Jackson Ranch specific plan to directly integrate that into our development code as Article 26. And then it would also incorporate reference changes to make sure that we've got consistency in there in section 102, 107, 201, 306, and 2501. Those are just reference pieces that make sure that we've got consistency in it. This ordinance also incorporates the change of zone district boundaries to make changes to zone district map 301, and that is to incorporate the 3 different zone district land uses for the Jackson Ranch specific plan that include the commercial thoroughfare, innovative commercial, and specialty ag. So those are all embedded in the proposed ordinance for you. We would ask that you hold a public hearing to consider that proposed ordinance and then introduce the ordinance for its first reading, but ask that you waive that first reading. And then if approved, our intent would be to bring this back to you on January 26th for the second reading. So that concludes staff's presentation, unless you have any questions for me.
Thank you. I have none. Any questions from the board? Seeing no hands raised or hearing no questions, we'll go ahead and open the public hearing at this time. So, Madam Clerk, do we have anyone that wishes to speak on the item?
No, and we have received no correspondence.
Okay, we have, we'll go ahead and close the public hearing at this time and bring it back to the board for deliberation.
There are no questions or comments. I'd like to move to approve and waive the first reading of the order.
Second.
Okay, we have a motion and a second to waive the first reading and approve the ordinance. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
We have 5 in favor. Oh.
Mr. Chair, if I could just clarify for the public record that the board voted to waive the first reading, but it cannot approve the ordinance at this meeting until it receives the second reading on the 26th. Thanks for letting me clarify.
Thank you. Okay, let's see. We had 5 in favor, correct? All right. Okay, we'll move on to board member announcements and reports. Supervisor Verboen.
I'm good, thank you.
Okay. Supervisor Fagundes.
I'm good also, thank you.
Thank you. Supervisor Neves.
This time, thanks.
And Supervisor Valley.
Yes, Mr. Chair. Mr. Chairman, I first want to start off by thanking our clerk of the board, Catherine, and our deputy clerk, Melanie, for helping out. I was able to have a very nice private swearing ceremony amongst my family last Tuesday. They were helpful in getting me the language, and I did get the form that Catherine gave me to get filled out by the witness who swore me in, which was Mayor of the City of Corcoran, Pat Nolan, and I thank her for that. So as soon as I get an opportunity, I'll get that document over to the clerk. Mr. Chair, I did want to just say that you know, I wish we could have had a little bit further discussion for clarification on the mask policy, just so that way we don't put out, you know, the wrong image to the public and to our employees. If there was something that could have been amended in the language to get the 5-0 vote, that would have been, I believe, a good direction to the county employees, but also to the members of the public. Mr. Chair, as you know, we have a $300,000. We spent $300,000 on a campaign outreach urging the public to mask up. And so with some no votes as it relates to our county employees masking up, that could be perceived a little different. And so I'm not saying that that was the case. I'm saying that maybe we could have got to an agreement on something that, you know, we could have had a unified message on something that is important to masking up. Especially relative to the near 100 people in Kings County who have already died from this terrible virus. And all I want to do moving forward is continue to work together, hopefully with a unified message, so we can get past this terrible time in the history, not only of our country, but of the world right now. And with that, I want to close very positive and thanking Mr. Hill and his hardworking staff and everybody else who's helping as we switch over to focus on giving out the vaccinations. I do want to thank him for working very swiftly for getting us online with that survey. I believe that is a great asset, a beautiful tool. When I saw that on the news, that Tulare County had launched that, and I texted Mr. Hill. He said he was already on it. and that our county would be launching our own version. And so they are moving swiftly and working hard. And I just want to close by thanking them for that. Thank you, Mr. Chair.
Yeah. Hey, thank you, Supervisor Valley. And I agree. I think we always need clarity in our policy, and I think fortunately or unfortunately, state law is state law when it comes to mask and Cal OSHA and all those other things. And I've in a private business setting, Cal OSHA is a formidable consortium, and they're not very forgiving on anything. But I think most importantly, we want to ensure employee health and safety when they're on our premises. If not, we expose the county to challenging financial issues. So thank you again for your comments, and I have no comments at this time, and so we'll move to board member announcements and reports. And I'd first like to go to our clerk of the board, Catherine Petralia, as a short announcement presentation.
Thank you. Thank you, Chairman and members of the board. This is Catherine Venturella, clerk to the board. I just wanted to take a moment to share, as you all are aware, today is Melanie Curtis, Deputy Clerk of the Board's last meeting. Her last day of service as a Kings County employee will be on January 15th, 21. I'd like to take this opportunity to thank her for all of her work here in the past almost 6 years. She made it by 2 months. She missed 6 years. For all the projects that she spearheaded, and especially for all of her work on getting the board meetings set up to be electronic, and for rolling with all the changes during the pandemic, and to wish her best of luck as she moves into a private sector job. Thank you, Melanie.
Thank you, Catherine. I will miss everybody very much, and I appreciate the opportunity to serve the board.
I know where you're going, so I'll bother you where you end up. So. You can't shake me that fast. But I do appreciate the work you've done. I nicknamed you 2 cents from the day you got here, and you've always first to come up with your 2 cents on every item that came across the board agenda, and I appreciate that. And I respect you for all the hard work you've given the county, and keeping Catherine in line and keeping us all in line. So wish you all the best in the future. So good luck. I know you are going to work for family, so I think you will be back here in a 6-month period, and begging to come back too. So I wish you all the best.
Thanks, Doug.
Mr. Chairman, on behalf of District 2, I also want to thank Melanie for her service to the county at wide. Thank you, Melanie.
Thank you.
Thank you, and Melanie. Thank you again for your service to the people of Kings County. And you guys sit on top of a big heap on a weekly basis, and folks send you information with the best hopes of completion. And I know many times it's not quite complete, and you work together to meet a deadline every week. And so thank you both for your professionalism and your efforts to make sure that we have clear and orderly meetings every Tuesday, and that the information that we provide is accurate and as close as we can get to accurate, and doing that in a professional manner. So Melanie, thank you again for your service.
Thank you, Supervisor Peterson.
You bet. Okay, if there's no other comments, we'll move to back to Rebecca for the remainder of the board correspondence.
Yes, those are very nice comments, and we all are going to miss Melanie very much. So we have no updates on board correspondence, no upcoming meetings or events. So upcoming agenda items for board meetings, admin will have a couple of COVID-19 related items. We'll have our routine weekly update, and also a Board of State and Community Corrections coronavirus supplemental grant coming to the board next week. Also, a public hearing from administration on appointment of the county road commissioner, and a proclamation of school choice week next week for admin. From the agricultural commissioner, an agreement with the state for the county's Asian citrus psyllid detection program will come before the board, and a couple items from fire, acceptance of the Homeland Security Grant, and also the Emergency Management Performance Grant. And that's it for next week.
Very good.
Thank you, Mr. Chair.
Okay. So looks like we've come to the end of the agenda. I know we have no closed session today. 11 o'clock, we will have the California Community Housing Agency regular meeting. And we will not have a meeting on January 19th due to the observance of Martin Luther King Jr. holiday. So thank you all.
Yeah, something happened.
Oh, are we live or not?
It looks like we're still live. The camera feed cut out though.
I was trying to type to him.
You're live.
Okay, well then, very quickly before we lose audio, I will go ahead and adjourn the meeting. Thank you.
Back at 11, right?
Yes.
Do we have a separate meeting code for that?
It'll be the same meeting. We're just going to pause this one.
Okay.
Hey, Mr. Chairman, if it's all right, I won't be available for the 11 o'clock. I didn't see any forfeit votes, but I won't be available, okay?
Okay. Noted.
Thank you.
We muted yet?
I can still hear you.
I can still hear you.
I just muted them.
Okay. Thank you.
Yeah, of course.
Thank you, Supervisor Peterson.
Thank you. Okay, we'll be back. We'll stay here, but we'll be back at 11 o'clock for the council meeting.
Yes.
What about now?
Can you hear us, Aaron?
Cool.
Yep, hear you loud and clear.
Hey guys, can you hear me?
Yes, sir.
Okay, perfect.
Not quite 11.
Yeah, no, exactly. And hey guys, sorry, it was a complete oversight of mine. I forgot that at the beginning of the year, we got to elect officers. So we'll do that at our next meeting. So apologize. So we're going to have to just go with the old existing 2019 chair.
As long as it
2020.
comes with the pay, the same pay, I gotta get paid for my services.
Dougie, send me your bill, bud. We'll get it done.
Yeah, he said, I'm doing this for what?
I'm sure your rates have gone up in 2021.
Well, at least $1 an hour because it's minimum wage.
Oh man, crazy year. Glad it's over. Jeez Louise.
No, I don't think it's going to get any better.
Well, this
I think
is
it
true.
worse.
I was surprised you guys were already done with your Board of Supervisors meeting. Usually I thought it might be a long one today.
Yeah, no comment.
No, I hear you.
Okay, Aaron, are you ready?
Yep. I just started recording once again.
Okay.
Okay, good morning. Today is Tuesday, January 12th, 2021. This is the California Community Housing Agency regular meeting. Madam Clerk, please call the roll.
Joe Nevs? Joe Nevs?
Here.
Richard Valley is absent. Doug Verboon?
Here.
Craig Peterson?
Here.
Richard Fagundes?
Okay, we have 4 members present, 1 absent. We're ready to conduct business today. We're first to be the consent calendar.
Nope, approval of minutes. Very bottom.
First item will be approval of the minutes from December 15th, 2020.
Neves moves to accept the minutes.
Moved by Supervisor Neves, second by Supervisor Peterson. Madam Clerk, please call the roll.
Joe Nevs?
Yes.
Richard Valley is absent. Doug Verboon?
Yes.
Craig Peterson?
Aye.
Richard Fagundes?
Okay, 4 members have voted to approve the minutes as presented, and we'll move on now to item number 3, consent calendar. Moved by Supervisor Fagundes,
Neves seconds.
second by Supervisor Neves. Madam Clerk, please call the roll.
Joe Nevs?
Yes.
Doug Verboon?
Yes.
Craig Peterson?
Aye.
Richard Fagundes? And
4 in favor, and we will approve the consent calendar as presented. We'll move on now to item number 4, and Scott Carper is on the line to present this item. Good morning, Scott.
Good morning, everyone. So thanks for joining today. We have a new CalCHA deal coming for you beginning of the new year. So this is called Stone Ridge Apartments. We've been in discussions for quite some time now. This is actually our first deal that's being brought to us besides Catalyst Housing. This is kind of an outsider that heard about our program and brought us this opportunity. So it's HCF Development. We are going to acquire Stone Ridge Apartments. This is currently a 209-unit multifamily rental housing facility located in Walnut Creek, just around the corner here from our staff's offices. So again, you guys, the setup here is exactly that, like you guys have seen before. Similar in structure to all the other assets that we have acquired, like Annandale, Verdana, Green Valley, Serenity. All of our roles and responsibilities are exactly the same as in all those prior transactions. So again, before you guys today, CalCHA is being asked to consider the issuance of up to $120 million of governmental purpose bonds to acquire this project under our middle income housing program. As you guys can imagine, the city of Walnut Creek is beyond thrilled that we have an asset here that we are going to be acquiring. So working with the city, they are members to CalCHA. And again, very excited that we are going to step in and acquire this asset. So the project's currently controlled by HCF Development. So we're going to keep them on as our asset manager, who will be overseeing our property manager. And the existing property manager on the property now is FPI. And you guys may recall, but FPI is currently our property manager on 2 of our existing CalCHA assets. So they're well aware of our program. And so they're going to stay on as the property manager. So you guys remember all the public benefits of our program. Again, CalCHA is going to acquire this current existing market rate apartment community. And then we're going to put in our middle income housing restrictions for any residents earning anywhere between 80 to 120% of the area median income. And again, we are going to cap all annual rental increases at 3%. Also, again, as you guys recall, part of our program is we have a non-displacement policy. So once we acquire this asset, which is looking to be around the end of February, again, we're not going to kick anyone out. Anyone that wants to stay in is going to stay in. And then just as the natural turnover happens when people move out, we'll then look to replace that tenant with a middle income affordable housing tenant. We're also going to grant any excess project revenues to the city of Walnut Creek. And then at the end of our 30-year bond term, when there's no debt on the property, we're going to gift it to the city of Walnut Creek, which obviously they're thrilled about. Again, you guys, the finance team is all the same parties that you guys are aware of. Again, we got Oric as the bond counsel. The underwriter is Jeffries. FPI is going to be our property manager. You guys have us as staff. The only different party is, again, our asset manager is not going to be Catalyst Housing on this asset. It'll be HCF Development who brought us this opportunity. In all the bond docs, again, we have all the same protections that are in all of our other deals. Again, we have no liability for the debt service on these bonds, CalCha, nor to any of you board members. Also, our insurance consultant that we hire is reviewing all the current insurance to make sure we're adequately covered as the owner. And so that's looking good as well. So that's it on this asset, you guys. Again, we're looking to close around February 26th, but everything's going great and looking to seek your guys' approval today. And I can take any questions if you guys have any.
Thank you, Scott. Any question or comments for Scott?
There are no questions. Move to approve.
Motion approved to move by Supervisor Fagundes.
So Neves.
Second by Supervisor Peterson or Neves, one of them. And Madam Clerk, please call the roll.
Joe Neves,
Yes.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, 4 in favor, 1 absent. Thank you very much, Scott. Appreciate that. Look forward to having this project completed and done. We'll move on to the next item with the public comment. Any person may directly address this board at this time on any item on the agenda or on any other item of interest to the public that is within the subject jurisdiction of the board, subject matter jurisdiction of the board. 5 minutes are allowed. Do we have anybody that has a comment?
I do not have anybody with their
Any
hand
staff
raised.
comments, staff updates? Scott?
Yeah, you guys, the only update is we actually, so far, the only assets we've had acquired under this CalCha program have all been in Northern California. We are kicking off our first Southern California opportunity here in the next couple of weeks. It's down in the city of Monrovia. I am going to be back before you guys here in, probably a couple of weeks with a new opportunity, but we're pretty excited about this new asset that we're going to acquire down there. And the city of Monrovia has already joined CalCha. And again, as you can imagine, extremely excited that CalCha is bringing this opportunity forward. So that's the only update. I definitely will be back before you guys here soon with another opportunity.
Okay, well, thank you very much. Look forward to it. Okay, at this time, we'll adjourn. Thank you very much.
Awesome. Thanks, guys. Happy New Year. Talk to you soon.